it's Dr. Rick, and this is an unboxing of PTS lotion. PTS lotion, technically it has a couple of cool things like frankincense, myrrh, coconut oil, lavender. So all those you probably know about. However, it also has CBD and THC. So CBD THC comes from the medical cannabis plant. So not only do you have the components of lavender, this is Now Foods lavender, pretty good. I like the flora of lavender. It's very healing. If you ever get massage lavender, or you do your laundry, a lot of things are scented as lavender. It might not be real lavender, might be some chemical that smells like lavender. So I'd get the real lavender. This is essential oil from pure lavender flowers. This is frankincense, or at least I love abundance, and happens to be 2020 is the year of the rat. The rat is usually representative of abundance and wealth. So this is my essential oil that I have in the office. Abundance, pretty cool, but frankincense is in here, in addition to citrus and a couple other things. So here is the ingredient label for this. I doubt that you can read that, but jojoba, coconut, and all that stuff. And here is the breakdown: 200 milligrams of CBD, 100 milligrams of THC. And we are going to open this and smell it. So that's the thingy. So what I was going to bring this up for is it is now winter, and I'm just going to show you my crap. So I have to, that's pretty nasty, but right there is my scab I usually crack this open from washing all the time. And it gets to the point where it's painful to wash, because if I wash my hands with soap and water, or I use alcohol, the alcohol is terrible. Teclocin that you find in alcohol, or hand sanitizer, by the way, is cancerous. So soap and water I try to go with, but the rules are you're supposed to squirt on the way in, on the way out. That's the way the rules are. I don't know. So that's the cover. So I try to use, not to divert your attention, but I use this. This has, so you can get this anywhere, Costco, Target, but it has ceramide in it. This is not a ceramide commercial, but this is, I like the waxy component of ceramide to not only moisturize, but to put a shell on top, just like waxing a car. You want to make the car nice when you wash it and use soap, but you don't want to cover that with wax so that the water beads up and doesn't penetrate into the paint anymore. Same thing with this. I want this to be waterproof, so I'll use a moisturizer, but not just a regular moisturizer, one with ceramide. Now, sometimes you can use lavender, but if I put this essential oil on this cut, it would probably sting a little bit. So this would be nice. Now I think that the turnoff for some people might be it smells like marijuana. So I'm going to see what happens. And it doesn't smell like marijuana. It smells like a combination of different oils. It's almost like I'm smelling sandalwood. I didn't see that on the label, but sandalwood is so healing. Oh, 57, I can't read anything. It's a good thing this isn't like a book for flying a plane in the middle of an emergency crisis, but I'd be like, just fly the plane straight. I don't know. So I'm sure there's sandalwood in there in addition to a couple other things. But wait a minute, for some reason they have it in a dropper. I mean, you're not supposed to put this, you're supposed to put this on your skin. I don't get it. So I guess, oh well, let me just try it. That's probably too much. So I'll put it on my hand, and then we will rub it in, and then I'll get so high. No, you don't get high with this. So those of you who have apprehension, number one, no stinging, and you saw that was broken open. No stinging. It has still that smell that I can't put my finger on, but that oil, I'll have to dig down deeper and maybe put it on the post-credit thing. But so this is what I would do with the oil. I realize that some people will hope, especially my older folks, will hope that if you put this on your skin, it will penetrate down into the bloodstream and start to take effect. And those of you who watch my videos, I like to have high CBD in the system at all times. I think everybody should be doing CBD for life. Now, whether you get it from hemp or medical cannabis, I think that the chances are higher if you go medical cannabis, but I have some very good hemp stores that I refer to. I just say, since I see a lot of people that have the card, just go get it in your hemp store. Your medical cannabis dispensary. So the objective is to determine whether it penetrates in to effectively get blood levels up or not, and we don't have any data on that. I haven't seen any data. I would hope that when you put it on like this, that it does get in. But two things: when you use it, if you have a lot of subcutaneous fat, I don't have much fat. You can see my blood vessels. It theoretically should penetrate at least to the skin and subcutaneous layers. Maybe muscle, maybe not. Now, if you can get something on top of the skin into muscle, like an anti-inflammatory cream, like Voltaren, then once it gets into the muscle, it shoots off into the bloodstream, gets everywhere. That's why when you put Voltaren solution on, maybe the gel, maybe not, but the solution, the drops, you can actually have an ulcer. And it has happened. I put it on my knees, and I did it because it was a sample way back in 2012. And I did it 3 times a day. It took care of my knee pain, but then I noticed a burning in my stomach. Yes, anti-inflammatories like Voltaren, Motrin, ibuprofen, Aleve, naproxen, they cause ulcers, and kidney damage and hypertension and heart attack. Bingo. So anyway, yes, if you can get down deep enough, then it theoretically should get to the rest of the body. Whether this dosing will get to the rest of the body with one application, probably not. Will it get to... If it gets into the muscle layer, will it penetrate even deeper into the bone? Maybe. Again, that's theoretically. I've had a few patients use the topical when I first started certifying for medical cannabis. My older patients, 70 to 80 years of age, because they're very, very apprehensive, and I didn't want to give them any more anti-inflammatories. So I said, hey, why don't you try this? Gave them a $10 OAPP card. Half of them to 3/4 said they felt something, which is a positive. Whether that's placebo or not, I don't know. Doesn't matter. But for this case where I'm trying to recommend it to other people, I would be apprehensive to say that putting it on my skin with the amount of lack of subcutaneous fat, I don't think that CBD, this is dominant CBD, so CBD, THC. I don't think that the dominant CBD or the little bit, the non-dominant THC will get into my bloodstream enough to affect my brain. If I eat this, probably, I don't know if I would eat it. Probably, to try. I'm not working tomorrow. Get some popcorn, watch a movie. So, even the creams, the gels, I have apprehensions. Now, I think it's worth a try if you just have arthritis and you're really apprehensive. But having said that, where it might not get in, I would still be careful if I was a truck driver requiring a CDL or a DOT certification, because you can get tested, and even if it's on the skin, you still might turn positive. I've been told by CBD specialists with regards to hemp, just assume, even though it's 0.06%, just assume you'll turn positive and you won't have any problems, because a lot of my truck drivers do have back pain, and I want to give them something to help them, but I'm afraid that they're going to get tested. So I wouldn't mess around with the hemp. Now, for everybody else, if you wanted to try it, but try it for 3 months straight and don't do anything else different and see what happens. Now, talking to my pharmacists, you really have to have, I would think you would have dry skin and it would get in deeper, but you have to have moist skin or a nice barrier of skin to allow the oil to penetrate in, supposedly. So I think that because of the cuts that I have, maybe they're getting through the cuts and they're making me high now. I doubt it. But I would do it on a regular basis for at least 2 to 3 months, for perhaps 3 times a day. Now, whether you use your usual moisturizer beforehand or not, I think this might block it. The more stuff you have on your skin, the higher the possibility that it'll just sit on top. If it sits on top, it's going to be rubbed off eventually. So I would try as little as possible. honestly, my thinking is that without knowing the strict pharmacology or pharmacokinetics, if my skin is dry, like coming out of a, but I should say if my skin is it doesn't have any oil, but it's moist from water imbibing, like coming out of a shower, I think this will get in deeper and better. Now, if you come out of water where your skin imbibes water, come out of a shower where your skin imbibes water, and then you put a moisturizer on, I think that's going to block it. So I think you change around the kinetics of the absorption. So for this talk, if you use a topical and you like essential oils, I would say give it a try, but be liberal with it. Now, I can still feel it. It's not showing anymore, but I can still feel it. So I only put like a tiny drop on and it covered my whole hand. Now, whether I just put a whole drop on and I start slipping on stuff and I shake hands and it rubs off on everybody else, that wouldn't be cool. Oh, that's another thing. So you have to be careful about who you touch, because if you take care of a little kid, that kid will probably absorb the CBD THC. Again, it's hard to measure that, but assume it will pass. If you have a DOT husband or wife and you hug them, technically you can get it in. So just be careful about that. And again, if you wanted to try it as an experiment, no other changes except for this, 3 times a day as best as you can remember for about 2 to 3 months straight, and then take a measure before and after that to see, did it help with my arthritis or not? So you have to be patient with this stuff. If you wanted something that hard hitting and you wanted to see effects fast, especially if you're arthritic, then I would say take the CBD twice a day by tincture form, and I have videos on that. And also take the THC at night to knock you down into sleep, because I think we are so terrible with our sleep that the lack of sleep, even if you're used to it and even if you can function, really sets you up for inflammation during the day. So at least if you control the pain at night, good night's sleep, there's nothing better than a good night's sleep and refreshed state that will take care of the level of pain. Even if you have pain, if you're irritable, the pain stays at 10. If you have pain and you're happy, it might go down to like a 6 or a 5, and that's a difference. Subjectively, it's a difference, and sometimes that'll be the difference between eating and not eating, moving and not moving. So I think it's worth it. So that's how I would play this. As far as whether it will help clear up my skin, I'm not sure. If you have psoriasis or eczema, I think it's worth a try. If you have seborrhea of the scalp, it might be a problem when you get up in the hair because it's shiny, it's oily. So it changes around the texture of the hair. As far as putting on the face is totally different than the rest of the body. There's more blood vessels in the face, and people will see the shine. It might not be cool, but if you have the typical eczema and psoriasis, well, psoriasis is usually an extensor surface issue. Eczema can be anywhere, especially annular. So regardless where it is, I would pick one side of the body, say the left. If you have rashes to both sides, pick the left side of the body. Do this 3 times a day, just see what happens and compare. At the end of 3, for a rash, you can probably see results in about 3 weeks, 2 weeks. But for arthritis, it'll probably have to be more because you're going to penetrate deeper. Superficially, 3 weeks. Deeper bone pain, probably 3 months. So hopefully this gives you a little idea. Please put in comments down below which topicals you use at your dispensaries, whether in Illinois or outside. Otherwise, I'll see you at the next video.